Hello, my dear friends. I'm Dr. Rose Khavari. In my more than 15 years working in functional urology and men's health, I've had the privilege of hearing thousands of stories. But there's one that has always stayed with me from a married couple, let's call them John and Mary. They were in their 70s and had been married for nearly 50 years. When they came to see me, John was there for a men's health issue, but I could feel a silence between them, a distance that felt wider than my own desk. During our conversation, Mary, in a voice that was almost a whisper, shared, "Doctor, we live in the same house, but it feels like we're two strangers. We eat at the same table, we watch the same TV shows, but it's been years since we've truly touched. Not a hand held, not a hug or anything more. The silence has become so loud, and now we just don't know where to begin again." John and Mary's story is not unique. I know that many of you watching this video today might be feeling the very same way. Perhaps it's because of the changes in our bodies, the stresses of life, or simply because time has unintentionally built a wall of silence between you and your partner. Today, we aren't going to talk about anything complicated. Together, we are going to talk about a topic that is incredibly important for our overall happiness and health: how to rekindle intimacy and closeness after years of silence. And I want you to know this journey isn't about pressure, but a hopeful invitation to reconnect with the person you love. Why closeness matters so much in our later years. First, let's redefine intimacy. Many people automatically assume it only means sexual intimacy. But intimacy is so much broader and more beautiful than that. It's holding a hand on a walk. It's a warm hug at the end of the day. It's the way two people can look at each other and smile without a single word. It is the feeling of being safe, understood, and cherished. As we get older, this connection becomes more important than ever. Medically speaking, acts of closeness and affection help our bodies release oxytocin, often called the love hormone. This hormone helps reduce stress, lower blood pressure, and brings a sense of peace and happiness. It's like a natural tonic for both our minds and our bodies. Studies have shown that a strong sense of connection and belonging can boost our immune system and even help us live longer. Conversely, living with loneliness and a lack of connection can be as harmful to our health as smoking 15 cigarettes a day. Think about that. So rebuilding intimacy isn't just about fun, it's about actively investing in a healthier, more fulfilling life. Part 1. Understanding the changes. A deeper, kinder look at our bodies and minds. To begin this journey, the most important first step is to understand and accept the natural changes our bodies and minds are going through. And I want to emphasize that word natural. This isn't a sign of failure or anyone's fault. It's a part of the beautiful, complex process of living a long life. Let's take a kinder, more detailed look at what's happening, because knowledge truly is power, and it's the first step toward compassion for yourself and your partner. A deeper conversation for the ladies. We often hear the word menopause, but we don't always talk about what it truly means for our sense of self and our intimacy. Yes, the decrease in estrogen can lead to vaginal dryness, but let's be more specific so we can be more practical. This isn't just a lack of moisture. The tissues of the vaginal walls can become thinner, less elastic, and more fragile. This is a medical condition known as genitourinary syndrome of menopause, or GSM. It's why intercourse might not just be uncomfortable but genuinely painful. I want every woman hearing this to understand pain during intimacy is not something you have to endure. It is a signal from your body that needs attention, just like a headache or a sore knee. The great news is, we have so many wonderful tools today. We talked about water-based lubricants, which are essential for immediate comfort during intercourse. But you can also think about vaginal moisturizers, which are different. You use them regularly a few times a week, not just during intimacy, to help restore moisture to the tissues over time. They are like a daily moisturizer for that delicate part of your body. And of course, there are prescription options like low-dose local estrogen therapies, creams, tablets, or rings that your doctor can discuss with you. These are very safe for most women and work directly where they are needed without significantly affecting the rest of your body. But the changes aren't just physical, are they? The hormonal shifts can affect your libido, your desire. Sometimes you might just feel touched out, especially if you're a primary caregiver for grandchildren. Your energy is finite. Beyond that, let's talk honestly about body image. Our bodies have chronicled our lives. They've carried children, weathered illnesses, and earned every single wrinkle and silver hair. Yet in a world that worships youth, it can be hard to look in the mirror and feel desirable. You might feel less confident, and that lack of confidence can be a bigger barrier than any physical symptom. I want to tell you all, your body is a testament to your journey. It is worthy of love, pleasure, and kindness. Learning to embrace this version of yourself is a profound act of self-care, and it's a gift you can give not only to yourself, but to your relationship. A frank discussion for the gentleman. Now for the gentleman, we mentioned andropause and the decline in testosterone. This is a much more gradual process than menopause, but its effects are just as real. A lower libido is common. But let's focus on erectile dysfunction, or ED, because it is surrounded by so much silence and shame. I want you to think of ED not as a failure of masculinity, but as a health signal. It is very often a vascular issue. The blood vessels in the penis are some of the smallest in the body. When they have trouble dilating to allow for an erection, it can be an early warning sign, a canary in the coal mine, that larger blood vessels like those in your heart or brain might also be having issues. This is why when a patient comes to me for ED, I don't just think about sex. I think about their heart health, their blood pressure, their cholesterol, and their blood sugar. Addressing ED is part of a holistic approach to keeping you healthy for years to come. And then there's the psychological component, which is enormous. After one or two instances where an erection is difficult to achieve or maintain, a cycle of performance anxiety can begin. You start to worry it will happen again. That worry itself releases stress hormones like adrenaline, which are the enemy of an erection because they constrict blood vessels. It becomes a self-fulfilling prophecy. You start avoiding intimacy, not because you don't desire your partner, but because you fear failing. This is where communication becomes your greatest ally. Sharing this fear with your partner can be terrifying, but it can also be liberating. It changes the dynamic from a performance to a shared experience. And please hear me when I say this, talking to your doctor is a sign of immense strength. We have a whole range of safe and effective treatments today, from oral medications to other therapies. There is absolutely no reason to struggle in silence. For both of you, navigating life's other challenges together. Beyond these individual changes as a couple, you are navigating so much more. Life at this age carries other burdens that can profoundly impact intimacy. Let's talk about chronic health conditions. If one of you has arthritis or chronic pain, certain positions may be off limits. The simple act of moving can hurt. The fear of causing a flare-up can make you both hesitant. This calls for creativity and open communication about what feels good and what doesn't. If there's a history of heart disease, there can be a very real fear for both of you that sexual activity could trigger a heart attack. For what it's worth, for most people cleared by their doctor, the physical exertion is about the same as climbing 2 flights of stairs. But the fear is powerful and needs to be addressed with your physician. Diabetes can affect nerve endings and circulation, impacting sensation and function for both men and women. The side effects of medications are a huge, often overlooked factor. Common blood pressure medications like beta blockers, antidepressants, SSRIs, and others can all have a significant impact on libido and sexual function. It's always worth having a conversation with your doctor to see if there are alternative medications with fewer side effects. Then there is the emotional landscape. Caregiver fatigue is real. If one of you is the primary caregiver for the other, it can be difficult to switch from a caring role to a romantic one. The lines get blurred. And let's not forget grief and loss. Losing friends, siblings, or dealing with the cumulative losses of life can leave you feeling sad and depleted with little energy left for connection. Understanding and naming these challenges is the first step. It releases the pressure of pretending everything is the same as it was at 30. It's not. And that's okay. We are not trying to recapture the past. We are learning to build a new, deeper, and more compassionate form of intimacy that fits the people we are today. Part 2. The first step. Mastering the art of conversation. After years of silence breaking, it feels like trying to move a mountain. The fear is palpable. What if they laugh at me? What if they don't feel the same way? What if I make things even more awkward? These are all valid fears. But the cost of silence is connection itself. So let's build a practical toolkit for this conversation. We talked about choosing the right time and place and using I statements. Let's expand on that. When you use an I statement like, I miss our closeness, you are giving your partner a gift. You are making yourself vulnerable, and that vulnerability is an invitation for them to be vulnerable too. Here are a few more gentle conversation starters. You know, I was thinking the other day about how we used to just sit on the porch and talk for hours. I miss that feeling of being so connected to you. Honey, I want to talk about something that feels a little awkward, but it's important to me. I've been feeling a bit distant from you lately, and I'd love to find our way back to each other. Can we talk about it when you have a moment? I read an article, saw a video by a doctor that talked about how relationships change over time, and it made me think of us. It made me realize I want to make sure we're always nurturing our connection. For the more direct approach, I love you so much, and I feel like we've lost some of our physical closeness over the years. I want to be honest and say that I miss it. I'm not sure how to start, but I'd like for us to try. But what if the conversation doesn't go well? This is a very real possibility. Your partner might get defensive. They might shut down or change the subject. They might say, "What are you talking about? Everything's fine." This is often a defense mechanism born from their own fear or insecurity. If this happens, the most important thing to do is not to escalate. Take a deep breath. Your goal for this first conversation is not to solve everything. It is simply to plant a seed. You could say something gentle and reassuring like, "Okay, I hear that you feel things are fine. For me, it feels a little different, and I just wanted to share that with you. Maybe we can just let it sit for a while and talk about it another time." I understand this might be uncomfortable to talk about. I don't want to pressure you at all. Just know that I love you and I'm here to talk whenever you're ready. You're right, we have a lot going on. Maybe now isn't the best time. Let's find a time this weekend when we can just relax and connect. Remember, you are trying to undo years of habit. It might take more than one attempt. Patience here is not just a virtue, it's a strategy. The goal is to make the topic of your connection a safe one, and that safety is built over time with gentleness and persistence. And when you listen to what is not being said. If your partner says, "I'm just too tired," they might really be saying, "I'm afraid I can't perform," or "I'm in pain." If they seem distant, they might be feeling insecure about their own body. Listening with your heart means hearing the fear and vulnerability hiding behind the words. This one conversation, even if it's clumsy and imperfect, is the first stone laid in rebuilding that beautiful bridge between your hearts. Part 3. Redefining intimacy. Your step-by-step roadmap to reconnection. Once you've started talking, it's time to act. But we're not jumping to the finish line. We are going to build a new foundation brick by brick. Let's temporarily set aside the pressure of intercourse and think of this as a gentle exploratory roadmap back to each other. I often give my patients a framework like this, and I encourage you to try it. Make a pact to approach it with curiosity and without judgment. Step 1. The foundation of words and shared space weeks 1-2. For the first couple of weeks, your only goal is to cultivate non-physical intimacy. You're rebuilding the friendship and emotional safety that all physical intimacy is built upon. The daily check-in. Make it a point every single day to have a 10-minute face-to-face conversation with no distractions. No TV, no phones, no newspapers. Sit at the kitchen table with a cup of coffee. Ask questions that go beyond "How was your day?" Try "What was the best part of your day?" Or "What's something that's on your mind?" Or "Tell me about something that made you smile today." The goal is to see the world through their eyes again. Schedule a date. We mentioned this before, but let's make it a non-negotiable. Once a week, do something together that is purely for fun. It could be going to a matinee movie, visiting a nursery to buy a new plant, playing a round of cards, or listening to an entire album of your favorite music from when you were dating. The point is to create new positive memories and remind yourselves that you are partners in fun, not just partners in managing a household. Express appreciation. Make it a daily practice to find one thing to thank your partner for, or one quality you admire in them, and say it out loud. "Thank you for making coffee this morning, honey. It started my day off right." Or, "I was watching you with the grandkids today and I was reminded of what a kind and patient person you are." This rebuilds the emotional bank account which may have been overdrawn for a long time. Step 2. The return of casual safe touch weeks. 3 to 4. Now we slowly reintroduce touch, but in a way that is completely free of expectation. This step is about refamiliarizing your bodies with each other's presence in a safe and comforting way. The 6-second hug. When you hug, don't make it a quick pat on the back. Hold it for at least 6 seconds. That's the amount of time scientists say it takes for the oxytocin, that wonderful love hormone, to be released in both of you. It literally calms your nervous systems. Do this at least twice a day when you say goodbye in the morning and hello in the evening. Intentional hand-holding. When you're out for a walk or watching TV, consciously reach for their hand. Don't just hold it passively. Feel the texture of their skin. Give it a gentle squeeze when something on TV makes you laugh. Let it be a silent, constant conversation. The lingering touch. This is about creating small moments of physical connection throughout the day. When you walk by your partner in the kitchen, gently place your hand on their shoulder or the small of their back for just a moment as you pass. When you hand them a cup of tea, let your fingers touch for an extra second. These are tiny deposits of affection that add up, signaling, "I see you, I'm with you." Step 3. Exploring sensual, non-goal-oriented touch, the next phase. This is the most transformative step for many couples, and it requires the most trust. The goal here is to explore touch for the sake of sensation itself, completely removing the pressure of it leading anywhere. This technique is sometimes called sensate focus. The hand massage. Sit facing each other. One of you closes their eyes. The other takes their hand and for 5 minutes just explores it. Use a nice smelling lotion. Massage the palm. Gently pull each finger, trace the lines with your fingertip. The person receiving the massage's only job is to breathe and feel the sensations. Don't talk, just feel. Then switch. It's incredibly intimate without being overtly sexual. Taking turns with touch. Agree that for 15 minutes, one person is the giver of touch and the other is the receiver. The receiver lies down comfortably, perhaps in a t-shirt and shorts. The giver's job is to explore touching them anywhere except for genitals or breasts. It could be stroking their hair, rubbing their back, massaging their feet, gently tracing patterns on their arm. The goal is for the giver to learn what the receiver enjoys, and for the receiver to learn to accept pleasure without feeling like they have to do anything in return. This is about discovering a new map of pleasure on each other's bodies, free from the pressure of performance. By following this roadmap, you are systematically rebuilding trust, safety, and connection. You are relearning each other's bodies and hearts in this new season of life. When you feel this deep emotional and sensual safety, physical intimacy in whatever form feels right for you, both becomes a natural and joyful expression of that connection, rather than a source of anxiety or a chore to be completed. It becomes a celebration of a lifetime of love. So we've covered quite a bit of ground together. I know it's a lot to take in, but this is a journey of small, gentle steps. Before we finish, I'd like to review the key points I hope you'll take with you. 1. Intimacy is health. Remember that connection is not a luxury. It's a vital component of your mental and physical health, helping to lower stress, boost your immune system, and fight the damaging effects of loneliness. 2. Be a compassionate expert on your body. Understand the natural changes of menopause and andropause. Treat your body with kindness and explore the many wonderful tools available from lubricants and moisturizers to having an open conversation with your doctor about medical options. 3. Communication is your superpower. A gentle, honest conversation starting with "I feel" is the key that unlocks the door. Be brave enough to start it and patient enough to continue it even if it's clumsy at first. 4. Redefine the destination. Let go of old expectations. Intimacy is a vast landscape that includes holding hands, deep conversations, shared laughter, and gentle touch. The goal is connection, not a specific act. 5. Follow the roadmap. Don't try to leap from silence to sex. Rebuild the foundation first. Start with words, move to safe touch, and then explore sensual touch without pressure. Be patient with the process and with each other. I want to return one last time to the story of John and Mary. Several months after their first visit, they came back for a follow-up. This time I saw them sitting closer together in the waiting room. John instinctively reached for Mary's hand as I invited them in. Mary smiled at me and said, "Doctor, we've started talking. We've started taking walks together every evening and we hold hands. Last week he put on an old record and we danced right there in the kitchen. It was a little clumsy and we laughed a lot. We still have a long way to go, but at least we've started walking the path together." That moment reminded me of something precious. It is never ever too late to begin again. It's never too late to find each other once more. The journey to rekindle intimacy isn't a sprint. It's a slow dance that requires patience, understanding, and a whole lot of love that I know you both still have. I hope our talk today has given you a little bit of hope and courage. Please remember, you are not alone on this journey. If you found this video helpful, please consider giving it a like and subscribing to the channel so we can continue having these meaningful conversations. And if you know someone, a friend, a sibling, a neighbor who might need to hear this message, please don't hesitate to share it with them. Thank you for spending your time with me today. I wish you the very best of health. Take gentle care of yourselves and of each other.